Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me is Dr. Hunter Cherwek, Vice President of Clinical Services at Orbis, to discuss the true impact to healthcare systems as a result of COVID-19 and how that's impacting eye health specifically. Dr. Cherwek, it's great to have you with us. Welcome to Trade Talks.
Oh, it's great to be here. Thanks, Jill, for having me.
You got it. And the pandemic has upended our lives, in particular the way that we seek healthcare for other issues. What can you tell us about that?
Yes, I think we're even seeing it here in the United States, where many people are afraid to go to their eye doctor. They're staying in homes, even if they're experiencing an eye problem, or they know they have an eye disease like glaucoma or diabetes. And that's becoming a really big problem where backlogs are being created and patients are losing vision because they're afraid to go to their eye care provider.
On a domestic level, we're seeing increased screen usage, higher levels of stress, and people who aren't going to their doctors or kids who aren't getting screened in schools. That's going to have an impact at some point. What do you think that could be like?
Oh, absolutely. And it's having an impact now. I mean, children are not being screened in the schools. Elderly patients are not getting cataract surgery. Diabetics are not getting routine eye exams. And many glaucoma patients are not going and getting their medicines refilled or their pressures checked. So that is definitely going to create a backlog of care and patients who are going to have problems because they did not address eye conditions in time.
You're known for your work globally. Tell us about how this has disrupted your efforts in other key markets.
Yeah, so Orbis is a nonprofit organization. We're most famous for our Flying Eye Hospital, which is a US accredited hospital on board an MD-10 aircraft. Right now, the aircraft is grounded because of the pandemic. The good news is so many of our other activities are having incredible growth, especially our telemedicine and distance learning platform, CyberSight. This allows for distance diagnosis as well as doctors and residents around the world to share knowledge and do continuing medical education in the comfort of their own home.
What is Orbis doing to ensure that doctors aren't falling behind?
Yes, and that's really where CyberSight has been a crown jewel this year. We've had over 400% growth, and many of the doctors around the world are tuning into our webinars, where we will literally have over 100 countries interacting live with a teaching session and going on the CyberSight website for telemedicine to discuss complex patients or take our courses. So while certainly we have not had the use of our Flying Eye Hospital this year on our clinical programs, our distance learning, our rural programs, and our vision centers, especially in India, have had unbelievable growth to meet the needs of our patients in the pandemic.
Let's talk about emerging markets. Do you think that can help combat the pandemic? Tell me what you think that's going to look like.
Absolutely. And one of the things I'm very proud of in India is where we have these vision centers in the tier 2 and tier 3 cities that have really now become not only hubs of eye care, but for patient education, community care, and discussing things like hand washing, mask use, etc. In southern Ethiopia, where we distribute an antibiotic called Zithromax, which you probably know, for a disease called trachoma, we're using those sessions while we're distributing antibiotics to talk about disease awareness with COVID, hand washing, mask use, etc. So for us, we're using our current community education platforms and networks to also educate about COVID and the pandemic.
Dr. Cherwek, let me throw one more question at you. When we get to the other side of COVID-19, do you think that there will continue to be this virtual teaching, virtual medical visits? Because it sounds like you're actually reaching more people than you would have just physically only having the Flying Eye Hospital.
Absolutely. We've been invested in distance learning and simulation for over 15 years. And really that building the ark before the flood has been a huge investment for your organization and our beneficiaries. I only see that growing more in the future. I don't think we're going to go back to not doing distance learning, blended learning, simulation. What I'm really excited about is how we're also using new technologies like artificial intelligence. I believe we're the first healthcare organization to democratize AI for machine mentoring, where we're using algorithms and our AI platform to teach residents and doctors around the world. So for me, this explosion of technology, the innovations that the pandemic has required are only going to help us leapfrog and add to our existing clinical training portfolio. We do not want a lost generation of residents and eye health professionals. We want residents to be graduating even through the pandemic with better skills, more equipped with knowledge and the latest technologies and trainings. And that's really been possible at Orbis through CyberSight. So it's been an incredibly draining year for everyone, but it's been a very exciting year for us to see all of our hard work in simulation and in distance learning paying off. And literally we are connecting the world now through CyberSight.
That's incredible. That's really remarkable. Doctor, thanks so much for all the great work that you're doing. Thanks for joining me on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.